Hi everyone. I'm really excited to have Dr. Nidhee Sachdev join me today. We're going to do a pop-up Instagram live fertility Q&A. This is part of my expert series, but we have a very specific topic that we're going to discuss. It's basically fertility support for the South Asian community, and she's going to give us insights as a South Asian fertility doctor. So please listen in. If you know anyone from the South Asian community who's struggling with fertility, this is the show for you. I'm going to just bring her up right now. So, as you know, she's been on this show a few times. We've done 3 fertility Q&As with her, and she also came on and did a genetic screening talk for us. Hi, Nidhee, how are you?
Hey, Dr. Aimee, I'm great. How you doing? Happy Saturday.
You know what? I think that I had my earphones attached to my
Oh,
phone, so I don't know that people heard me. So, everyone, you guys, thank you, Dr. Sachdev, for joining us. We're going to talk about fertility support for the South Asian community, and I'm so glad that you had time to join me like this so last minute.
yeah, I always make time for Dr. Aimee.
You're the best. You're the best. So why is this topic so important to you?
Well, because I'm Indian. I grew up in the Indian community, the South Asian community, and for me, I grew up identifying with my culture, and my family, we placed a strong importance on our culture. And I realized after treating patients that there are certain aspects of our culture that play a role in fertility and trying to get pregnant. And I've kind of identified that in some of the patients, and I thought it'd be important just to talk about it.
Awesome. And are there some underlying health issues that are more prevalent in the South Asian community than in other communities? And if so, what are they?
Yeah, so first, South Asian, the term South Asian most commonly includes people who come from the country of India, Pakistan, Sri Lanka, and Bangladesh, although the terms can vary. But yeah, so people who come from the South Asian community, we're more predisposed to certain diseases, particularly ones that involve our increased risk cardiovascular disease and endocrine diseases such as diabetes, insulin resistance, glucose intolerance, and even thyroid disease, which plays an important role when trying to get pregnant.
Okay, so break it down for me. I'm getting out a pen and a paper and I'm listening to this show right now. I'm going to go to my doctor. What test should I ask for?
Okay, so first, why does it matter if you have insulin resistance and trying to get pregnant? One, diabetes is a big deal, not just for your overall health, but when trying to get pregnant or actually being pregnant. The other issue is that insulin resistance or sensitivity has an intricate role in another ovarian syndrome that we call PCOS or polycystic ovarian syndrome. And that's a common ovarian disorder that can play a big role in our fertility because it can interrupt our menstrual cycles, make them irregular or longer. It can cause excess androgens or hair growth in our face or other parts of our body or acne, and it can cause our ovaries to have multiple cysts in it. So it's important for us to identify, okay, are we someone that might have that? Do I have irregular menstrual cycles? Do I have excess hair growth? And being of South Asian, oftentimes our hair is darker and more coarse. And so it's hard to say, well, do I have excess hair growth or is that just culturally? So if you feel like you fit into one of those categories, I would say go to your doctor. Let's one, figure out, okay, are you at risk for diabetes? A blood test that we can get is something called a hemoglobin A1C. It checks the amount of glucose we have in our blood that's been there for several number of months. So by checking that, we can say, hey, are we actually diabetic or are we a pre-diabetic? And that's important when trying to get pregnant. Other things we can do is that if you feel like you're having signs of excess male hormones, is that possibly have a blood test to say, hey, do you really have it and what's going on? And if you're not trying to get pregnant and that's something that's bothersome, there are medications that we can prescribe that can actually help with that. And that might help your overall quality of life. Other things you want to be evaluated for are thyroid, right? Endocrine disorders and thyroid issues are prevalent, and that can affect our menstrual cycles and trying to get pregnant. And then just basic things like making sure our blood pressure is good, right? Because we're at predisposed to having elevated blood pressure, even though we may not be in our 50s, but as we approach our 30s and 40s, we're at a higher risk. Getting our cholesterol checked, making sure that we're not having elevated cholesterol levels, things of that sort.
And how far ahead should we be doing this prior to planning for pregnancy?
So if you have an underlying issue that you already know about, you're concerned about, I would say at least 6 months prior to getting pregnant so that you could be evaluated and possibly treated and have things under control. If you don't identify any factors, I always think it's good for anybody, regardless of what culture you are, to go to either an OBGYN or fertility doctor at least 3 months or so beforehand, get what I call a preconception counseling appointment to make sure that everything seems appropriate. You're immune to the certain diseases like the measles and German measles that you should be, things of that sort.
And I know I'm not saying anything that will surprise people, but you have to have sex in order to have a baby if you're trying at home and you're in a mommy-daddy relationship, right?
Yes. Yeah.
Yes. And so sexual dysfunction can sometimes be an issue in many communities, but maybe more so in the South Asian community. Is that a correct statement?
Well, sexual dysfunction is prevalent across, I would say it's prevalent equally across all ethnicities, but in the South Asian culture, oftentimes sex is not something that's discussed or openly discussed as often. And so, whereas maybe in other cultures, or not even cultures, just other situations or communities where people are more open about talking about sex, they may be identified prior to getting to the point where they're trying to conceive. So I do tend to see it in the South Asian community. I don't think it's necessarily more prevalent. I just think that it hasn't been addressed until they're trying to conceive and then they realize that it's an issue. And sexual dysfunction can be many things, but in men or women. And so pain with intercourse, the inability to have intercourse or discomfort with it is important to identify, because it's going to add even, for many, trying to get pregnant is stressful. But on top of that, if you're having difficulty with, having intercourse, it adds even more stress to the process.
So if you're a woman out there watching this and you're relating to some of the things that we're talking about, how can she talk to a doctor? Like, what should she say when she calls the clinic so that they understand what's going on at home and so they can address her concerns?
Yeah, I mean, I would say you don't necessarily have to tell the clinic. When you start talking to your doctor, you can talk about it. And if you don't have a doctor you feel comfortable with, oftentimes a fertility specialist, it's part of my history. I don't even give you the option of not telling me. I ask you in a way that helps it kind of come out organically. So sometimes patients don't mention anything to me until I start asking.
Yeah. And I think that is important to know that this is what we do all day long. We talk about sex. How is it going in the bedroom? We talk about your sex life. You and I don't like sperm emergencies, right? When it comes to IUIs and IVF procedures, there's always something that can be done, like freezing sperm ahead of time, medications, and stuff like that.
Totally, yeah. I think what people don't understand is that I think some people think when they're having sexual dysfunction, it's like mental or emotional, but a lot of times it's biological or physiologic. So what women may not understand is that our pelvis is made of a connection of multiple muscles. So when women are having difficulty with intercourse or pain with intercourse, it actually could be a medical condition in which we can refer you to physical therapists that can help with that. Mm-hmm. And maybe your goal is to be able to have intercourse, or maybe your goal is not to have intercourse, to be able to tolerate a speculum exam, or just to have an insemination. There's things that can help. Or maybe you're having lower back pain that's related to that. Maybe your goal is to improve that. So It's not just that the goal always has to be to have sex. The goal is your goal, and how can we get there? And if you're really having difficulty with intercourse, we can circumvent that. There's inseminations that we can do. There's medications. There's help. We can help you. So having issues with intercourse should not be a reason that you can't get pregnant.
Amen. Your goal is your goal, and we will help you and figure out how to get there. Right? That's amazing. Okay. So are there stigmas related to different fertility treatments for South Asian men and women, for example, related to egg freezing and single parenthood and egg donation, IVF, more so than, let's say, other communities, or maybe not, but what are they?
I mean, I would say all of them. I do think that IVF and fertility treatment in general is becoming more prevalent. I think there might be less stigma associated with that. I think the one thing is just, being open and communicating. I think some people in certain communities don't feel comfortable talking about their issues. And I think that's changing over time, especially fertility treatments becoming more prevalent. But I think as a result of that, people don't often have the support that they need. And I think along with that comes egg freezing. In many cultures, the getting married and starting a family is, has a lot of importance played on that. And it's particularly for women, as we get older and if we're not married, and there's a lot of cultural stigma that comes with that. And when talking about egg freezing, I think I've had a few patients say that, they're really excited about it, but they feel uncomfortable or nervous speaking to their older family members or older generations about that. Mm-hmm. And I always tell patients, I say, look, it's a medical procedure. You're doing something to preserve your health in the future. So imagine if your parents had a way to preserve their coronary arteries from getting clogged, right? That you would recommend that they do that. It's the same thing, is that you're preserving your fertility, and it doesn't mean that you're necessarily giving up on that goal that you had. You're just looking for ways to increase your options.
That analogy is a great one. I mean, I think most people, all people can understand that. And I think if you have a parent, for example, that's maybe being a little bit more critical with some of the choices that you're making, if you present that as an argument in a really positive way, I think that makes like what you're doing more understandable, and hopefully you'll get more support. And if not, what can patients do to get more support if they're not necessarily getting it from their loved ones?
Yeah, I would say, look, regardless of what anyone says, just be respectful and understand that they're coming from a different perspective. And whether you agree or disagree with that perspective is different, but everyone's coming from a different place. But I would say try to seek support maybe in a different outlet, like friends, coworkers, or even the online social media community, right? I mean,
Right.
if you don't feel comfortable talking about your journey, maybe there are other people who are, and just by reading their stories and seeing the connections that they've made and watching their videos can be of support to you.
Yeah, I agree. And there's something that I've read online and I just don't know, or not just online, but in some studies. I'm not sure if it's a fertility myth or not, that South Asians have a lower IVF pregnancy rate than non-South Asians. Is that really a thing?
So there have been a few studies, not a whole lot. And so the initial studies thought, okay, well, maybe there are lower fertility treatment outcomes in South Asian women versus Caucasian women. And there's actually a study done by my friend at Stanford in which she looked at South Asian women and compared their IVF outcomes to Caucasian women. And she looked at fresh embryo transfers versus frozen. And there was a lower success rate in the fresh IVF outcomes, but there seemed to be a comparable IVF outcomes rate in the frozen when South Asians were compared to the Caucasians. So, it wasn't a huge study, but it had a decent amount of numbers.
Mm-hmm.
I think the key is to understand is that not everybody's the same. And when talking about patients and understanding what's going on, considering maybe their ethnic background and maybe the genetics involved in that might play a role is important.
Yeah, I mean, I'm thinking with you sharing that perhaps PCOS has something to do with it, having a
Totally.
higher
Yeah.
count potentially.
Yeah,
That,
right.
that
Because
could be.
PCOS is more prevalent. And when you do a fresh transfer and you have a lot of eggs, right, even
Mhm.
though not all those eggs may make embryos, are all producing estrogen and your uterus can be out of sync with the embryo.
Right, right. So I have another question for you, and I'm wondering if
Yeah,
you'll share this with us. Like, what are your golden rules? Not just, I mean, it could be for South Asians, but of course for everybody. But I'm super interested also about the South Asian community for them to prevent infertility. If you were to have an audience full of South Asians, what would you tell them right now they should be doing?
well, I would say first, to be honest with yourself and identify any issues that you might see, right? One, do you anticipate having difficulty with intercourse, or are you having difficulty with intercourse? I think identifying those factors prior to the point where you're trying to conceive is important in seeking out help. Two, understanding the menstrual cycle and understanding your own menstrual cycle is important. Um, Many people don't understand how it works and they actually can't tell if they're having irregular cycles or not. So just paying attention to your body and maybe even getting one of those apps that keeps track of your cycles. Another thing is, don't wait too long to to seek help, right? If you've been trying for 6 months to a year and you're not getting pregnant, or you identify one of these problems beforehand, reach out, right? And if I think a lot of people are a little nervous or scared to reach out for help. I think the key is finding someone that you feel comfortable in talking to. Because, I say this to my patients all the time, we all have our goals, but if your goal is to have a baby, my goal is to help you get there without crushing your spirit, right? Because people don't get that fertility treatment is mentally and emotionally taxing, and that if the process to getting you there is so difficult, then that might ultimately change. Like you might end up with a baby, but if it was so traumatizing, you may not
Right,
come back to have a second one, and that
right,
ultimately effectively changes the trajectory of your life. So
right.
I think that's key. Finding support, whether it's through your physician, through the support staff at the office, through your friends, or through social media, I think that's key.
That's so important. I mean, we want to improve the lives of our patients, and if going through fertility is going to crush their spirit, I mean, that's certainly not something that we want for anybody.
Yeah, totally.
Okay. Well, thank you for joining us. I
Yeah,
really
of course.
appreciate you and all you're doing for fertility patients, for the South Asian community. Where can patients find you who are interested in seeing you?
Yeah, so I'm Dr. Nidhee Sachdev, or Dr. S as patients call me. I'm here in Newport Beach in Orange County, California. I practice at OC Fertility. I'm part of the CCRM Orange County Network. So if you can find me on Instagram at Dr. Nidhee Sachdev.
Awesome. Well, thank you for sharing with us your pearls of wisdom. And as everyone probably knows, you've been on 4 times now, I
Yeah.
think, and we've enjoyed every single session with you. And I look forward to having you back, especially for our next fertility Q&A, where you'll get questions from our audience. So thank you, Nidhee, for spending time with us on this Saturday.
Oh, thanks for having me.
Okay, we'll see you soon. Thanks
Okay,
again. Bye-bye.
bye.